I was kind of surprised, but I'm very thankful.
I know of at
Yeah.
least one other person.
Okay.
She's across.
She
Okay.
No, there's no way it would have, because she's totally, she runs that family, yeah. She runs the place. So I'm grateful for that, Yeah.
Friday through Sunday?
Yeah, 2 nights, Friday night and Saturday night. But there's so much kind of transportation, really, it feels like it's only one day, like I get all day
Did you pay for
Saturday.
it just at the restaurant?
No, my brother came to pick her up, and then I met her.
Yes, he was. And
So
actually,
he
I was
did
going first come in the door, so it's transportation.
But honestly, I wish he'd do all of it. Cause it's like, I know he has to go back to work, on that Monday.
Yeah.
It's just,
That is the worst.
it's nice to have the time,
She didn't get her out in the rain.
I don't know. But I'm sure with you, you have a lot of time on your hands, or you wish you had less time on your hands.
That's a good point.
Yeah.
I know, I can get that emergency thing off my phone, and you're still showing up.
Time. The sandwiches are over there. Help yourself.
All right.
Yeah.
Go in. Been thinking about you.
How are you? I'm
How are you?
I'm cool.
Good to see you.
They should all have some pins in their bag. Oh, okay. I wasn't sure, so. I'll leave them
I
back here.
appreciate that so much.
Alright. We can go ahead and get started whenever you want.
Okay, and I'm double checking. We have until what time?
About 1 o'clock.
Okay, great. We can do that. Okay. Well, hello, and thank you for risking your life to come to this class. We talked on the phone this morning and couldn't decide. It was kind of a little too late to cancel and to reach everybody. So we wanted to continue, but I know it's like flooding outside and pretty risky to drive and to walk in this kind of weather. So I appreciate you being here. And it's great, you get lunch, right? So when they feed you that.
Thank you.
Okay, well, let me tell you a little bit about myself. This is the On Your Feet Fall Prevention course. My name is Kristen Hullum, and I am a nurse, and I am the Trauma Injury Prevention Coordinator for St. David's Round Rock Medical Center. I have been a nurse for 24 years with St. David's Healthcare, and I worked at our downtown St. David's Medical Center for about 13 years in critical care. I did ICU and IMC, and I supervised critical care for a while, and then I moved up to Round Rock and into our trauma department. And so I've been in the trauma department now for about 11 years. And one of my roles is to get out into the community and teach injury prevention, because I don't want to see you in the trauma department, right? I kind of joke with our CEO that I'm like the one person out there trying to decrease our business. So I don't want you to ever have to come in as a patient for any reason, but certainly not for a fall. So that's what we're going to talk about today. The purpose of On Your Feet is to help you prevent falls by promoting some positive lifestyle changes, okay? A lot of people think when I'm trying to encourage people to come to this class, and they'll tell me things like, I'll just be careful. I'll just watch my step. Yes, I've fallen 5 times, in the last year, but it was because of this and this and this, and I'll just be really careful. And, what can I do about it? I'm 80, I'm gonna fall. Well, we can prevent these falls. They can be prevented, and it is possible you'll still experience a fall in your lifetime, I hope not, or for the people that you care for, but we can really put some things into place to help us prevent them, and so that's what we're going to talk about. Let me tell you a little bit about the fall statistics first. Every 20 minutes minutes, an older adult in the United States dies from a fall. Now, that does not mean they fall, hit the ground, and die right away, right? It sometimes is days, weeks, months, even within a year of their fall. But we can kind of trace everything back to the fall, right? And you probably know some people, sadly, that this has happened to. They have fallen and maybe broken a hip. That's the pretty big one, right? And then they were kind of never the same. From after that hip fracture, they were never very mobile again. Even with therapy or rehab, it was a tough road for them. Maybe they kind of stopped eating because they were feeling, just either depressed or unmotivated, or there's a whole bunch of different reasons, right? Maybe they stop eating and then they start losing muscle. It's just a whole thing. It's just a whole series of events. And the statistic is somewhere between 35 and 40% of patients who have a hip fracture die within 1 year.
Wow.
That's really scary.
Is that over a certain age, or is that anyone?
It's
or?
over the age of 65.
Wow.
Yeah. And so that's a really, really high number. And it surprises people, and yet you probably know somebody that's happened to, or heard of somebody, right? Okay, once you fall, you are more than 2 times likely to fall again. There's a few reasons for that we'll talk about. Falls are actually the leading cause of injury-related death for adults over 65. So I'm not talking about heart attack and stroke and cancer and those things, but for injuries, far more falls than anything else, like a motor vehicle crash or something. Falls are actually the leading cause of injury at, I believe, pretty much every trauma center in the nation, okay? Certainly for all of our HCA-wide hospitals across the nation. So that means far more than and I'm talking about all ages, right? Far more than motor vehicle crashes, which is our number 2. Falls beats that by almost 2 times, okay? Wow. Far more than motorcycle crashes. Falls is by far the leading cause of injury. And while we do have, when I look at all of our fall data every year, we have a couple little, like the 2-year-old that comes into the ER because he fell off the, kitchen cabinet, and a few of those little things, the roofer that fell off, who's 30 years old, somebody who fell off the ladder hanging their Christmas lights. There's a few of those things, but about 90% of our falls are over the age of 65. So this is very, very common. The average cost of a fall-related hospitalization is $30,000. I think that's probably a pretty conservative number. It brings the average down because there are so many falls, thankfully, that are somewhat minor. You don't necessarily need surgery. You might come into the ER and go home that next day or the same day if you're lucky. And so that does kind of bring the average down a little bit. But if you need a multi-day stay and a big surgery and rehab and therapy afterwards, that cost can go very, very, very high. Now, not that it all comes out of your pocket, right? Some does, but we're all paying for it, right? We're all paying for it with our healthcare costs across the country. Okay, so how do you know that you or your loved one that you care for is at a risk for falls? You guys are here in the class today, so that's probably, it's already on your radar, right?
Yes.
But there are people that you might know who are over the age of 65 who, again, kind of don't really understand their risk and don't understand that there are some proactive steps that they can take to decrease their risk. There are 2 screening tools that are approved by the CDC for healthcare providers to use. The most simple version are these 3 questions. And honestly, you probably didn't even know if they're doing it with you, and they should. You probably didn't even really know they were screening you for a fall, because they're not going to just be like, "Do you have a fear of falling?" right? And ask you questions. They're going to work it into a conversation with you. Hey, have you been thinking about falling? Are you worried about that at all? How's your balance, right? Do you have a little trouble with your balance or with walking? Are you feeling unsteady? Have you had a fall in the last year? So they kind of work it into the conversation, right? That's what we hope. They should be. They have about 9 million things to talk to you about in that 20-minute visit, and that gets really hard, but this is something that's really important for our geriatric providers to be addressing with their patients. This is the more in-depth screening tool, and we're going to do that together. So let me tell you kind of what you have in your bag. If you feel a few raindrops on the outside of your bag, I tried to like dry them off with my scrubs, but you might find a few raindrops. Okay, so you have a booklet in here, an On Your Feet booklet. The class doesn't necessarily go page by page or anything, so don't worry about that piece. I will refer to a couple pieces, or a couple pages rather, in the booklet. You should have a pen, and then in this kind of little packet of papers, that's what I want you to look at right now, and you are going to look for this questionnaire. This is for your own personal information, as on your own paper, okay? So you don't have to share this with anybody, but this is, if you have kind of ever wondered, like, I don't know, I'm a little worried about falling, but do I have an actual risk? This hopefully will answer that for you. You can answer this for yourself. You can also come up with another little column here if you want, for a person that you care for, one of your loved ones that you're caring for. You can kind of give them their own risk score off to the side too. Okay, let me read some questions. So, yes or no, I have fallen in the last year. Number 2, I use or have been advised to use a cane or a walker to get around safely. Now, I do.
I couldn't
Are you
find the
missing a
pen.
pen? Okay, take that one. Okay, so it may or may not have been a healthcare provider or a therapist of some kind that suggested a cane or walker to you. It could also have been a friend or a family member, okay? Like, I noticed you've been a little off balance. Have you thought of using a cane? Okay, so we're going to answer yes if anyone has suggested that to you. The next one is sometimes I feel unsteady when I'm walking. Okay, the next one is I steady myself by holding on to furniture when walking at home. So it doesn't seem to matter what I do for a living. My dad just didn't really want to listen to me, despite the fact that I literally teach this class. And you can call me the expert, right? But that was a big change for him to meet. Everybody smells. It's all going to happen. Just let it get it all out. It's our flood warning.
Yeah, I'm not getting them. Oh, there it goes.
Okay. That was a big change for him, and I was recommending that he started using a cane. He was very unsteady, and I could see that, but also he would like kind of ping pong back and forth to the furniture, right? Like hold onto the countertop, hold onto the back of the couch. Like he needed to find his next object to hold on to. So that would be a yes for that question. I am worried about falling. That's probably a yes, you're here. I need to push with my hands to stand up from a chair. So are your legs strong enough that you can just stand, or do you have to really push yourself up? Okay. I have some trouble stepping up onto a curb. That can be a sign of poor muscle strength in our legs. It can also be a sign of joint problems, right? Our knees can give us a lot of problems. I often have to rush to the toilet. Okay, so in social spaces, it's probably not considered great manners to talk about our toileting habits, right? But when you have RN behind your name, you get to talk about all kinds of things like that. Okay, so I will talk about toileting. You just listen and know that everybody in this room is probably in the same boat as you are. Okay, so if you are rushing to get to the bathroom, it is very difficult to sometimes be able to hold our urine, right? We not only have we aged, some of us have had 3 babies, like that becomes hard, right? It could just get a little bit harder to make it there, and that means we tend to rush. And rushing, we're going to talk a lot about rushing. You're going to hear me say it over and over again. That is one of the biggest reasons for falling. So we were going to plan ahead for that, and we'll talk about that. Okay, I have lost some feeling in my feet. You may or may not even fully realize that. But if you've had a little numbness, a little tingling in your feet, then we want to answer yes. For sure, if your physician has, talked to you or diagnosed you with like diabetic neuropathy, that's going to be a yes. Sometimes it's a nerve issue. Sometimes it's a circulation issue, and we have poor circulation, and that can decrease the feeling in our feet. And the problem with that is we don't pick up our feet as well. We tend to shuffle our feet a bit more when we can't feel them as well. And shuffling and not picking them up can lead to a fall. Okay, I take medicine that sometimes makes me feel lightheaded or more tired than usual. So there's all kinds of medications, and we'll talk more about meds, but that have kind of dizziness, lightheadedness, fatigue, as side effects. Some real common culprits, though, are your blood pressure and your cardiac meds, okay? The last 2 might surprise you a little bit. I take medicine to help me sleep or improve my mood. And then the last one is I often feel sad or depressed. And you might think, well, what on earth does that have to do with falling? Well, there is a lot of research that goes to show that when we isolate as we get older and we don't have a community, so it's so great that you guys come here and you have this community of people that, friends, clearly you know each other, right? And so that's your social world, and you may have some other social circles. But when we isolate and we're feeling lonely and maybe feeling depressed as well, that can lead to I don't feel like exercising, I don't feel like going out, it's really low energy, and it just all can lead to falls. In addition to that, a lot of the side effects for some antidepressants, which by all means we still encourage you to take if you need them, but some of those side effects can be dizziness or can lead to a fall. Okay, so add up your score. You don't have to announce it to anybody, that's just for you. But if you scored a 4 or higher, then this researched and validated tool tells us that you do have a higher risk of falling. Okay. So what are the things that do put you at risk? These are some of the risk factors, and then we're going to talk about them. So lower body weakness or feeling unstable, poor vision or dim lighting, improper footwear, okay, lack of safety in the physical environment, rushed movements, and medication side effects. We will go into detail about most of these. I hope your house doesn't quite look like the picture at the top, right? Every once in a while mine does. I have pretty small kids, so mine still looks like that every once in a while. But all the clutter that we have around us sometimes really can increase our risk of falls. It can be something that you trip on or that you slip on. If there's something in your path, we have a tendency to want to lift our leg up and over it. And that can be hard for an older adult who maybe has some balance or strength issues. And so that could lead to a fall. Let's talk about shoes for just a second. So we love our sandals here in Texas, right? As it gets to be hotter. But if we're going to choose a sandal, we really want to avoid the one on the left. That's just a flip-flop, okay? So the flip-flop kind of moves around on your foot. They usually don't have great support. Sometimes they get, I have some that are stretched out, you know, with the bands, and so they almost don't stay on my feet anymore. All of those types of things could certainly lead to a fall. Heels. I don't know if we're still wearing heels, ladies, but we should let those go. It's probably time to let those go, right? And they're so beautiful. I love shoes. I'm a shoe person. I love my shoes. I love heels. But I have also gotten to the point where I can't do these skinny little high heels, right? So if you're going to do a bit of a heel instead of a flat, then let's keep it relatively low, okay? So roughly an inch or lower, and a wide chunky heel is far better than like the narrow heels, right? So do a wide chunky one. Flats though, or just something with a teeny tiny little bit of a heel would be ideal. Yeah.
In your house, are shoes better than bare feet or socks?
Okay, so great question. So in your house, are shoes better than bare feet or socks? So they can be if it's the proper shoe, right? Slippers are a horrible idea. You know why they call them slippers? It's probably because they want you to slip your feet in, but they sure cause a lot of slips too. And we see patients, I'm not exaggerating when I say nearly every day in the emergency room, who come in with their slippers and after a fall, and those were the shoes that they were wearing, and they slipped in them, okay? Slippers are a terrible idea, so we don't want to wear those. If you're going to wear socks, then ideally we have the non-skid socks. You know those super fashionable ones we give you in the hospital? Okay. You can buy those, and you can probably buy cuter ones, and some of them say sassy little things on the bottom of them, and you can be cute about it. But those are great because they will help provide a little bit of traction for you so that you don't slip. Bare feet can be okay depending on your floors, okay? So carpet or almost a floor like this. I have these same floors actually, similar, like what do they call this, luxury vinyl something or other. At home, it actually has a bit of a texture on it, and even if you spill water on this floor, it doesn't get slippery. Tile, on the other hand, can be slippery with socks or bare feet, and certainly if it's wet, right? So if you're going to choose a house shoe, which we do love for you to have a nice house shoe, but with tread, okay, and a heel. So choose something that you can kind of slip your feet into relatively easy, but have a heel, okay? Skechers have, I'm looking to see if anybody has any of those on. So Skechers has some like slip-in shoes, okay? They're like tennis shoes, and you don't even have to bend over and you don't have to tie anything. Something along those lines, or something like a house shoe, but that has a heel and hugs your foot and has a tread, okay? That would be great. Okay. When we're out in the community, mobility out in the community, so you can control your home environment. You can't control what's out in the community, right? Now, you might have, most people have kind of their same regular places that they tend to go, which is nice because then you kind of know all about it, right? You know where to park, what path is the best, where's the handicap ramp if that's what you need to take. You kind of know a little bit about it. But you may go somewhere where you don't know, or you don't feel as comfortable, or they don't have a good setup, right, to help people out who might be at a high risk for falls. So we want to get in the habit of really always looking around at our environment. And I think that changing our mindset to this can be one of the most challenging things for older adults, or if you are helping to care for somebody and you're kind of needing to be their eyes, right? Because they may not be able to look for themselves very easily. We want to always look for things that can assist us. We want to think about where can we park. That would be best, and hopefully the parking spot's available, right? Are there parking blocks in the parking lot? Some have them and some don't. Parking blocks, though, are a huge trip hazard. It is great when they are painted a different color. So if they are like yellow, usually is what I see, versus, you know, whatever the grayish or black of the actual pavement, that's great. But there are a lot that they don't put that contrasting color, and it is virtually the same color as the rest of the pavement. That's a real problem for anybody, but especially for an older adult who might be losing their peripheral vision a little bit, and they have trouble seeing kind of what's down in front of them. They might be having trouble picking up kind of colors a little bit. If it has that contrasting color, then our brain tends to catch that a lot faster, a lot easier, I should say. Okay, so that means that we have to really think about it. I'm parking, I see there are parking blocks. We need to be very careful to step around the parking block. We would not want you to step over the parking block, okay? Although there are some people who are certainly agile enough to do that, there's many people who are not, okay? As they get older and they think they're getting their leg up high enough and they're not, and then they kind of catch their toe, okay? And that would trip you. If there are handrails at the stairs, use them, okay? Use those handrails if they are there. Not every place has them, even though that is kind of an ADA requirement, and they really should have them, but I think there's some rules and regulations I don't know everything about, but every once in a while there's maybe a shorter step, and that doesn't require a handrail. Or it's just kind of 1 or 2 steps up, and that doesn't require a handrail like a flight of stairs would. You might have just the curb. That's 1 step, right? And that can be really challenging. So I always like to kind of let people know, just in case you think like, oh, she's never had to be gone through this herself yet. I have. I actually had really horrible knees after 20 years of being on my feet with nursing. And so I had gotten to the point about 4 years ago where I could barely walk. I also had kind of become a little bow-legged, so my joints were just bone on bone, my legs were a little turned inward. I was in severe pain every day, so much so that sometimes by the end of the day, I couldn't go upstairs to tuck my kids into bed, which like brings tears to my eyes. And I would have to say, I just can't tonight, guys. Tell mommy, good night here, and then daddy will tuck you in. I had trouble walking around the hospital, and I really suffered with it for several years. And then finally, I just got to the point where I just couldn't do it anymore. And my youngest child, was potty trained, so that was kind of a time where I needed to get that handled before I could even think about surgery. So in 2022, I had both my knees replaced, 3 months apart, not at the same time. But I had gotten to the point where I really struggled with steps and even a curb, and would have to pause in front of the curb and then just really get my knee up. Or if I was stepping down, was almost worse than up. And I would have to turn sideways and kind of go down this way. I was a mess. I feel like I am a new woman now. So if you need knee surgery or replacement and you're on the fence about it, I cannot say enough good things about it. It's fabulous, do it. But I just say that story because I want you to know that I identify with the challenges of walking. I could barely pick my feet up. I actually did have a couple falls. I had tripped a few times. Hi, come on in. I had tripped a few times, so I have been there, okay? Pay attention to oncoming traffic, cross at corners and crosswalks. We don't have a heavy walking community necessarily here, but you can kind of think a lot about that like in a parking lot, right? So let's say you go park, you're gonna go into Michael's or Home Depot or whatever, and you know how you will park, and then you usually have to cross the driving path to get into the store, H-E-B, whatever. And so you have a choice to make, right? You can pause and let people come, or hopefully they're kind and they will stop for you and give you the little signal to go. But when they do that, what do we tend to do? We think, oh, I'm inconveniencing them, they're having to wait on me. Let me rush a little bit. Let me pick up my step. Let me walk a little faster. And that is something that would lead to a fall, okay? So don't rush. They have stopped for you. They can see that you might need an extra few seconds to cross. They're not going to change their mind in the middle of it and, run you down, okay? So they were kind enough to stop for you. Take your time and get across.
Isn't
Right.
that the law? Isn't that the law?
If it's in like a crosswalk area, it is. I don't know that that's
Nobody.
that doesn't mean anything to some people, but yes, it is. Okay. Oh, and I wanted to say sidewalks. So hopefully your sidewalks don't look like that photo. But even if they're not that bad, sidewalks can be a real problem. They lay them down in blocks, right? And so every once in a while those blocks shift a little bit, we have some cracks, and even if it is that much of a difference in elevation, that can be just enough to catch your toe and to trip you, okay? So I kind of say, remember that whole little phrase you'd say when you were a kid, step on a crack, break your mom's back? Okay, so it is a great idea if you can try to avoid the cracks, because you just kind of never know. So if you can kind of time your steps as you're walking to step over the crack as opposed to just before it or on it where you might catch your foot, then that would be great. All of this does require, though, a little bit of kind of mindfulness, right? And that's hard. When you were 20 and 30, you didn't have to think a thing about it. You just walked around and your brain didn't even tell you, oh, there's a parking block. Or, not in a, formally acknowledging it way. It was your brain just sort of saw it out of your peripheral vision and you stepped over it or around it, right? Mm-hmm. We have to be a little bit more mindful now about where and how we are walking. So try to get in the habit of scanning your environment. We don't want to look straight down because then we're going to kind of miss what's happening. We don't want to look too far ahead because we'll miss what's here. So we kind of want to be scanning up and down, straight ahead, and then maybe about 10 feet or so in front of us so that you can see, oh, there's a crack coming, I want to step over it, or I can see that that's uneven, okay, whatever the situation is so that you can navigate that safely. On a day like today where it is wet, even concrete can be slippery. Although it is rough and textured, some places are not, it's worn down, I guess. And so it can still be a little bit slippery. And especially if there's a little mud on it or wet leaves. Wet leaves are huge for slip hazards. And that commonly happens. And we can't control the leaves and where they blow and how they land, right? And when it's going to rain. But be very mindful so that you can not hopefully step right on the leaves and you can go around them if they're wet. What else can we do to be mobile in the community safely? So bring your cane or your walking stick with you. We're going to talk about how to use one in just a bit. But you may or may not use a cane all the time, and that's okay. But if you are feeling unsteady and a little imbalanced, consider getting a cane for certain occasions. You might not need it when it's completely dry and you're going to a place that you know, but there might be a place, maybe it's because it's raining, maybe it is a place that you're unfamiliar with, maybe you're going to like your grandchild's birthday in the park and you're going to have to walk over some grass. That's the worst because they have all these little divots and it's uneven and it is very easy to catch your foot or twist an ankle or any of those things right on grass. We would prefer you not walk in grass. But if you must, then having a cane that gives you a little bit of extra stability is a great idea, okay? You can get canes that fold up to about this long. And that could be great to just keep in your car for when you feel like you might need a little extra support. You can put it in a bag. So consider something like that just for the occasions for when you need a little bit of extra help. Plan for where you're going so you don't rush. You must have done that today, because even despite the rain, I had to leave certainly early because I knew I was going to drive like very slowly on I-35, and I did. But we don't want to rush, because again, rushing will lead to a fall. So if you are going to be a little late somewhere, just be late. That's okay, right? It's not the end of the world, truthfully. It's just not, okay? There are very few places where it's just going to be, absolutely catastrophic if you're late. Ideally, we plan ahead so that you get there early, considering that maybe you don't know where parking will be, maybe the weather, and you've had your time at the beginning so that you aren't having the tendency to rush. But if it gets down to that point, then just don't rush with your steps, okay? Use a flashlight when walking around at night and wear reflective clothing. So, a little flashlight that you can kind of keep on your keychain or in your purse is a great idea. They have these little LED flashlights now, or, truthfully, we all have them on our phone, and it's a pretty bright light. So you could certainly use that. I'm always afraid I'm going to drop my phone, so I personally wouldn't want that to be my normal practice. But you can get some great, bright little LED lights to go on your keychain, and that can give you a little bit of extra light whenever you need it. I am already having trouble seeing in dim light, so about the time that it is dusk, anybody else have trouble? Like when it is dusk, that's almost worse for me. It plays tricks on me. And it can be a real challenge to see everything. So anytime that you can illuminate your path, whether that's just in the parking lot, maybe you're out to eat a little later than normal, have a little flashlight, because don't trust your vision, and trust that I will see something if there's an object in my path. There's a good chance that you might not, right? So a little flashlight is great. If you're a walker and you walk your neighborhood early in the morning or in the evenings when it is dark, some type of reflective clothing is a great idea. That's not going to keep you from falling, but what it will do is actually, if you do fall, it should help people see you, okay? So they have reflective jackets that are like that. If it's summertime, you probably wouldn't want to put a jacket on. There are vests. There's like little beauty queen sashes that are reflective. Whatever it is that would work for you, do that with a flashlight so that, heaven forbid, if you were to fall, that a car would probably see you, lights would pick you up on the ground. Okay, so in your book, let me see, I believe page 9, you have a mobility plan. Let's see. And it actually starts on 7, so go one page before that and go to 7, okay? This is a place that you can fill out when you get home and have a chance to kind of look back at your calendar for things like, when was my last primary care checkup, okay? We really encourage you to see your primary care provider at least once a year, okay? So that is not a specialist. You might say, oh, well, I saw a doctor, I saw my cardiologist, or I saw whatever, but whatever other ologist is out there, okay? But we are talking about your primary care provider who is looking at the whole picture, okay? That's really the person that, and maybe a neurologist would do this, especially if you have a condition that can change your sensations, your nerves, things like that. But your primary care provider is really kind of the one who will oversee the grand, picture, who will hopefully test your feet and see how are your pulses, down there. So how is your circulation? Do you have a discoloration of your skin, or do you have some swelling down there that makes us think that maybe your circulation is compromised? Do you have some nerve issues? especially if you're diabetic and we know you're a higher risk for neuropathy, then we want to be sure that we are trying to catch those things early. So jot down when your last exam date was for your overall physical checkup so that you can be sure you get one within another year. Your eye exam is the same thing. So you might think, my prescription hasn't changed, I don't really need to see the eye doctor, right? Like I don't need a new prescription. But it's a really great thing to see them every year so that we can do those little tests, right? They, not we, I have no part of your eye exam. But they can do those little tests, that little dreaded puff of air on your eyeball, right, that everybody hates. That particular test is assessing for glaucoma, okay? They will check for something like macular degeneration, where you are losing your central vision, okay? And you may not even be aware in the very early stages of vision loss, central or peripheral, you might not even have really sensed it yet. So they can usually pick up on it, right? So it's that like, look straight ahead, tell me when you see my fingers, okay? They are looking to see, how is your peripheral vision? So go ahead and get that eye exam. They're also looking for cataract, which it happens to everybody, honestly, right? It's going to happen to everybody. If you're blessed to live long enough, you're going to probably get cataracts. When it gets to a certain level, and I don't really know what that level is exactly, but Medicare will cover
20/40.
There you go. So Medicare will cover it, and don't hesitate to get cataracts. So have you had your cataracts done?
Both eyes.
Okay.
I have, yeah.
How was that experience for you?
It lasted about 10 minutes in the surgery.
Okay.
I mean, the prep was, a lot longer.
Yeah.
It was nothing. It was nothing.
Yeah.
Thank you. Okay, so that's what most people say. Every once in a while I say, it's not a big deal, and somebody's like, it was so big a deal for me. But most people will say, it really wasn't that big of a deal, and I was so happy afterwards. Like, I came out with better vision. I didn't even realize how much trouble I was having seeing. So they kind of liken it to a really dirty windshield. When your windshield is super dirty and you feel like you can't see very well, and then you get that car wash and you're like, oh my goodness, look how clear everything is. That's a lot, like they say, having your cataracts taken care of is. So cataracts, though, and having a dirty windshield is something that could make you fall. So when you get to that point where you can do something about that, go ahead and take care of that for lots of reasons, but one of them is so you don't fall. If you do have a fall, we want you to be sure that you notify your primary care provider that you had a fall. You can get into the, we're so fancy nowadays with the portal, right? So you can, hopefully you figured out how to do that. But let them just know, hey, I just want you to know I've had a fall, or I've had more than one fall. I was injured and had to go here, or thankfully I was not injured, just had a few bruises, but I wanted to let you know. They may ask you to come in. That's kind of usually what that happens, right? They may ask you to come on in and let me see you. But it's a good conversation starter for something like, I, have been feeling more imbalanced, or I can't feel my feet quite as well, or whatever, the conversation might be, but why is it that you fell? And a lot of times people brush it off, right? Oh, well, it's because I tripped on da. And that may be partially true, but sometimes there's still an internal contributing factor that we want to look at, okay? We're going to talk about medications and exercise here in just a second. So guiding family caregivers. So I probably don't really have to tell you guys much about that, right? The importance of having a caregiver know everything that is going on with your loved one. For those of you who are all caregivers yourselves, don't neglect that you might need some care as well, okay? And I know that's a whole piece of this entire organization, is to make sure that you are getting some care yourself and support. But we really want to be sure that every single person, and it doesn't even matter your age, every single person has that one trusted person in their life who may not be a caregiver, but is who their like next of kin is, or it doesn't have to be next of kin. It can be a friend, it can be a pastor, it can be your neighbor, anybody who can fill that role of knowing your medical history, having a current list of your medications, and helping to guide us as healthcare providers in what you want to happen in case you can't speak up for yourself. So the hardest thing for us, and it happens truly every single day, multiple times a day, is when somebody comes in and they cannot speak for themselves for one reason or another, and we're kind of flying blind for just a little bit, okay? Now, it doesn't mean we're not going to do all the things you need to save your life, right? It doesn't matter what your medical history is and what meds you take. If we see that, you know, XYZ is going on, we're going to address those things. But we really, really want to know what your medical history is and what medications you are on. It helps us ensure that you continue whatever your normal meds are. If we don't know that you take, I don't know, whatever, you know, Lasix every day, then although we will at some point figure it out, like, they got a little swelling and, you know, better urine output, and let's start some Lasix. And then, oh, what do you know? They take that every day at home once we finally get their med list, right? So it kind of helps us from having to do too much detective work, okay? When EMS comes to your house, it's great if you can speak for yourself and you can say, you know, here are my documents, here's where I keep my meds. But don't trust that that will be the case. There are times when you may not be able to speak for yourself for one reason or another. Also, when we're kind of in an emergency situation, sometimes our mind goes a little blank, okay? And we get a little forgetful, and that's totally normal in kind of an emergency, panicky situation. We want you to be completely prepared for that, for you and for any of your loved ones. Prepared for EMS to come, and then prepared to get to the hospital. It is one of our just favorite things, and I'm sure you're picking up on my sarcasm, when EMS comes in with the patient and drops a whole grocery bag of 50 pill bottles on our desk, and we're like, we cleaned out their med cabinet. They just opened the med cabinet and brought everything, right? And we have to figure it out. Now, the good thing is, at least we can see what pharmacy you use and what your most recent things are. And then we can call CVS, hey, we have this patient, can you give us their most current med list? That is helpful. And hey, who are their prescribing docs, right? And maybe we can figure out some of who your docs are. So we're pretty good like Nancy Drews. But it saves us a lot of time if we already know what you take, okay? We also really want to know what your wishes are. Do you want to be resuscitated? Do you not? Those are really hard conversations to have. We're not going to really talk about that here, but it's something that you should be thinking about for yourself and for your loved ones. So how can you best prepare? Okay, you have a couple of different options here. So one is this blue folder that I've given you. This is an emergency document file for you. This is not to hold every medical paper you've ever gotten in the last decade, okay? Not that right. So this is for your emergency documents, your advanced directives. So that's your medical power of attorney, and then your advanced directive that where you have gotten to say your wishes for if XYZ happens, okay? If you don't have those documents already, then I encourage you to get them, okay? And do you guys help provide that support for emergency documents here?
Yes,
Perfect.
and we're actually gonna have a lunch and learn next month.
Perfect.
Details.
Perfect. Sign up if you don't have this all squared away, okay? It's really important to have that done. You can put a copy of your current med list and your history in here and your allergies. So allergies is another real scary thing. If EMS picks you up and you have this whole list of allergies, and we don't have that documented, we will always look to see if you've been in the for us, St. David's healthcare system. If your name and birth date pops up, then even if you went to a different St. David's hospital, we can still kind of see, oh, here are their allergies, okay? But if you go to a different hospital, like our hospitals don't talk to each other. I can't see what has happened at Baylor Scott and White or Ascension, okay? And they can't see what we've had. If we don't have any pill bottles, EMS hasn't brought any because maybe you were in your car, maybe you were in HEB, okay? And you didn't have anything in your purse, your bag, or your wallet. We do not know what your allergies are. We sure don't want to give you something that you're allergic to, and it's possible that that could happen, right? So, again, being prepared. So we want a current list of your medications. This is a wallet card for you. You can fill this out, you can put this in your wallet. We will check your wallet when you come in. We look for your driver's license, and we do look for any type of emergency card. I advise you to fill this out in pencil because things change frequently, right? Fill this out in pencil, and we will always verify this. So if we have on here your, does this one have your physician? Well, it does have a next of kin place, it has an emergency place. You can even write it like up here, like physician, Dr. So-and-so, okay? Because we will contact them and ask for the most recent list of your medications. And they should have that so that we can verify if that, in fact, is up to date and accurate. But it's really important that you make any changes as your meds change, and they change frequently. So, in case of emergency or ICE, card or notification is a great thing to put on your refrigerator, okay? And it doesn't have to be quite this formal. You certainly can print them out. There, you can find them online, you can print them out. You can also just use a piece of paper, okay? And maybe in red, so it gets everybody's attention, write ICE, real big on the top, okay? Because EMS is trained to look at your refrigerator. So you can do, hey, that's so great. Georgetown Fire Department has these File of Life. Okay?
I got these for Ollie also.
Wonderful, that's great. So that has a magnet on the back that can go on your refrigerator. It also has a medication card, but leave that one in there, and this one would be for your wallet, okay? You also, just to keep you from writing things multiple different places, if you need to like fill the most of the information out, but for meds, you can say something along the lines like, for meds and emergency documents, look for the blue folder in top drawer of desk. So EMS will see that, and then we'll know where to go to get your documents, okay? All right.
May I make a suggestion?
Yeah, please.
I learned this taking care of my mother years ago. I have a special little wallet folder that I carry in my purse. One of the pieces of paper is a list of my doctors. One of the pieces of paper, and I cut them so that they're small, is a list of my medications when I take them. The next one is a list of my surgeries. So they have doctors, they have my medicines, they have my surgeries, all in one place, and it's in like a little credit card holder.
Yeah.
In my wallet.
Perfect.
And
Perfect.
it's
That
on my
is so helpful.
It's on my computer, so when things change, I just have to print
And
it
you can
off
print out a new one.
and print out a new
Yeah.
one. But
Perfect.
they start asking me questions, and I just get this little folder out and I hand it to them and go, there's your information.
Perfect.
And it's current. You don't have to try to remember.
Yeah.
And they have it documented, and it's in my wallet.
That's excellent.
My son does it with his. I mean, I've just taught, and I carried when my husband was alive. I carry his in a separate place.
Okay. Yeah, that's perfect, perfect. And I love that you have it in your wallet. We are not gonna like dig through every bit of your purse to find something else, okay? So we will check your wallet, but we're not gonna really look anywhere else in your personal belongings. So it is great that you make sure that you can still kind of fit that in your wallet. Perfect. Okay.
And if you do wish to DNR,
Yep,
you need an out-of-hospital DNR,
that is true.
Mhm.
Yeah.
which is a separate
For
form
EMS, yeah.
for EMS.
So if you want to be a DNR, do not resuscitate, okay? You don't want us to do life-saving measures for you. In the hospital, that document actually won't apply to us. It's an out-of-hospital DNR is what that form is called. And so we cannot follow it, as a matter of fact. And that's why we need your advance directives to state what it is your wishes are. But then likewise, whatever we have in the hospital set for you, EMS doesn't necessarily follow. I will say that frequently with those types of situations, it's all happening very quickly, right? And they're not gonna stand around while somebody's heart is not beating while they wait, 8 minutes for you to go find a document. And so sometimes what will happen is they will start a resuscitation, and then it kind of depends on who's there, right? So you can say, he or she has an advance directive and an out-of-hospital DNR, let me go get that for you, but this is not what he or she wanted, okay? And especially if you are the spouse or next of kin, frequently they will actually be able to kind of stop on your word, okay? But in general, they will resuscitate at least until the hospital if there isn't a document to show that. And that's not necessarily what everybody wants. And so you just have to kind of plan and prepare for that.
I'm confused. I don't know why I would want a DNR for me. I definitely had one for my husband because who would want to come back in the condition that
Okay.
they were in, but.
Yeah. People have all different kinds of thoughts on what they want. And I will tell you that with your advance directives, you can be very specific on it. It doesn't have to be a all or nothing. Like, do everything you can or do nothing. It can be somewhere in between. And I've seen a lot of people who have different personal wishes, but only if this, and this happens. So for example, I will tell you my own personal wishes, especially as a mother of still 3 small children, give it everything you got, right? Do everything you possibly can. However, if after about 30 days, it is to be determined by multiple physicians that I would have poor quality of life, then go ahead and withdraw care. So you can do something along those lines if you want. And lots of people have different opinions. My husband's 96-year-old grandmother, against my wishes, it's not my decision though, so I keep my mouth shut, but she wants to do it all. She wants a full code. And that hurts my heart because I have coded a 90-something-year-old and it breaks my heart. 100% we break ribs. And then it's very hard to be successful in that resuscitation. So we've sort of put them through that for nothing. So not that they feel it, right? But nevertheless, it's not pleasant or pretty for anybody. But that's what her wishes are, and she is of sound mind to make that decision for herself, right? You could have on the flip side a 35-year-old who is just like, no, I don't want to ever, be on a feeding tube or a ventilator or anything like that. I will say that when you are making that decision, many times most of those things are temporary, okay? So they're temporary measures until we can get you better. So if you're willing to go through a temporary phase of some things, like some breathing assistance and some tube feeds and that kind of thing, as long as you get to what you deem to be a good quality of life, then let's do that. Maybe put that in your advanced directives. But if you're hardcore that you want absolutely nothing no matter what, we will respect that, but it does have to be in writing. Okay, that's a whole conversation that you will have at this next lunch and learn. Okay, so I'm going to skip ahead just a bit because I'm going to talk more about medications. But I do want to add something about vitamin D and calcium. So we think a lot about osteoporosis at this age, right? Now the hard thing about osteoporosis is that your peak bone mass actually happens about age 35. So for all of us in this room, that ship has sailed to some extent, right? But I don't want you to think that that means you can do nothing about it. You can still help your body to rebuild some bone, because bone is a living thing. It is constantly dying and rebuilding. You can help your body to rebuild your bone. You can also be sure that you are getting your bone density scans every 2 years. And we advise it for any menopausal, perimenopausal, or menopausal woman. Sometimes perimenopausal, maybe. But, and then even for men, and we've kind of done a disservice to men over these last few decades because for a long time we have just concentrated on older women, but we really know now that men also can be prone to osteoporosis. It just tends to be a later age. So it tends to be more in their 70s if it's from a natural occurrence, especially like drop in testosterone and that kind of thing, as opposed to women, when we might even be seeing it in our 50s, okay? It can accelerate and be earlier than that with some different medications that can affect our bones, as well as some cancers, okay? That can affect our bone loss and our bone growth. So there's too many variables to try to, tell you exactly what to do with it. We just want you to talk with your provider about it and make sure you're having those bone density exams. Make sure you're talking to them if you do have osteopenia or osteoporosis about whether or not a medication is appropriate for you to take, one of the actual osteoporosis meds. And then what else you can do at home, though, is making sure that you're getting plenty of calcium and vitamin D. So one of the papers in your packet is a calcium list and one is a vitamin D list. It kind of gives some suggestions on different foods so that you can try to get those through your nutrition. But you should also speak to your provider about whether or not you need to supplement calcium or vitamin D, okay? Many, many people do need to supplement, and especially with the vitamin D. And for a lot of folks, the recommended daily allowance, which is kind of that, like the RDA, right? Like for everybody across the nation, it is not enough. It is not enough vitamin D. So you want to get a vitamin D level drawn, okay, a blood lab for your vitamin D, and then you and your provider can decide what is appropriate for you to supplement, okay? We've talked about evaluation your feet, and we've talked a lot about getting your eyes done. I will add with your vision to just use caution if you get bifocals. If you've worn bifocals for years, you're probably the pro at it. But if you decide that your next pair of glasses is going to be bifocals, that transition period puts us at a pretty high risk for falls, because that lower portion of the glasses is meant for your up-close vision, so it means that everything down here is pretty blurry. So we need to be pretty careful with those, okay? All right, home safety checklist. Most falls do happen at home, so we want to make sure our home environment is completely safe for us. So in your book, you have a little homework. Page 9 is a home safety checklist, okay? So go home and start to look for the things that could be a fall risk for you. So we think about clutter, which we already talked about, okay? And that's pretty hard, right? Like if you haven't been a super neat person for 60 or 70 years, today's probably not going to be the day that you become super clean and organized. But try to keep things out of your path, okay? Try to move the furniture a little bit if you are constantly having to like go around furniture. Every time we pivot, that is a twist and pivot with our feet, and that can kind of throw us off balance. So if your furniture is set up in a way where you have to go around things constantly, then even though it may have been that set up for a couple decades now, we want to consider rearranging the furniture and opening up the space so that you always have that direct path to your couch or your chair or wherever, and we're not having to zigzag around things, okay? Rugs, that's a hard one for some people because they just love how a rug looks with their decor, right? It might be this fancy schmancy, like very expensive rug that you have, and that may not be something that you want to get rid of. So if you are married to the rug, then we want to make sure that it's not peeling up around. And so inspect the perimeter of the rug so that you can tape it down. There are lots of products that can do that for you. This is one example. Ruggies, and these are just for the corners. I will say that these are actually not my favorite though, because it won't, if the rug is so big that it's somewhere in the center between the corners where it's starting to flip, then that's not going to help you. They do also sell on Amazon or Home Depot or Lowe's or something like that. You can look for, this one's a little bit different, but you can look for double-sided rug tape, okay? And then that is what you would want to put around the entire perimeter. This one is actually an anti-slip tape. It's the kind of thing that you kind of see often on stairs, like it has some, like a sandpaper kind of grip to it. You can buy this. You can buy it in lots of different colors, which is great for your vision. But you can put that on a doorstep or on patio stairs or anything like that just to help keep you from slipping. There are a few places where we need rugs, right? So our advice is to try to eliminate rugs as much as you can. But we do need a rug, usually by the front door or a mat of some kind, so that you can dry your feet. We don't want to say don't put a rug and then you have a day like today and it's all wet and you have tile and then you slip, right? So we need to be able to dry our feet like by the front door and the back door. We also probably still need some kind of rug in the bathroom, okay? We just want to be sure that it's a really good non-slip rug. So be sure you're checking the back of that. If it's getting old and worn down, replace that.
Could I just add, I had a question, because that was kind of my big question coming here, is that we got rid of all the throw rugs in our house, and my mom tripped on one, you know, so that kind of prompted, you know.
That was a trigger, okay.
Yeah, and I pulled away the rug that's in front of our patio door. We have a sliding glass door, and but when it's rainy like this, I put it back out. You know, like I hid it in my room and now I bring it up.
You could do that.
But I also feel like, I don't know, I just didn't know if so you're saying some rugs are okay, but you would tape it down, or?
So it depends on the rug. So there are some, this is an outdoor rug for you as opposed to indoor.
It's inside on our carpet, and
It is
we're
inside.
coming in from the outdoor,
Okay.
but it's inside.
Okay.
Yeah.
So yes, sometimes it's the lesser of two evils.
Yeah.
And to put one there because we need to dry our feet, right? If you're going to choose a rug, it just might be that you can find a slightly better choice to put down there. So this is a carpeted area though,
Yeah.
right inside your door.
Yeah, yeah.
Okay, so probably what I would suggest, because if you get anything that has some height to it, that's going to be a trick. So do you know what I mean? There's not one in here, but do you know what I mean when, like by the front door probably, I think I drive my feet on it, but like an industrial type of, it's like a heavy plastic on the back. It is usually pretty thin, but heavy. and it is that material that would let you kind of dry your feet easily. It is so heavy plastic that those tend to not curl up quite as much. I mean, they do sometimes. I see them every once in a while, and that means they need to get thrown out. But they tend to not do it quite as much as like a fabric heat rug would. You could also try more of a bathroom mat, and that would probably work if it was a thinner one, and then had that non-skid back. But I think your idea of picking it up and putting it down is
Yeah.
is probably a good idea.
Because I love the idea of taping something,
Yeah.
but then you can't take it off to wash it or whatever. you
It
might
is a
need
little
to
bit
do.
more challenging,
Yeah.
that is true,
Yeah.
and I don't know how, the tape would not work well on the carpet.
Yeah.
Yeah, but in which case you could consider putting it outside the door, like a true outdoor thinner rug outside the door, as opposed to inside.
Yeah. I kind of just resigned myself a little bit to just tracking stuff and then we clean it later. I don't know.
I know,
It's
that's
hard
not the
to-
best either, right?
Yeah.
Yeah, but there are, look around at like Home Depot or Lowe's or Amazon, if you're an Amazon shopper, there are some probably better options. But you're gonna want something with some weight so that it won't curl up, especially if you cannot tape on the carpet, but it should be thin. Yeah, okay. Okay, this is just kind of a fun little game. I'm not gonna spend really much time on this because we've kind of still got a lot to talk about. You have a copy of this little cartoon in your packet there, but we just like look around and see all the crazy fall risks in this picture. And probably nobody's house is this crazy, but you might have a couple of these things. And this is not just a fall risk, this is a fire risk too. He's got like a dangling cigarette over here and the smoke alarm looks broken. There are no handrails on the stairs. But again, there might be a few of these things, even though this is kind of meant to be funny, there's a few of these things that might apply for you. So we have rugs, and we have just those fabric rugs that flip over, and they slip, right? You can go skating on these. Those are the worst ones. They really should go, okay? Clutter on the stairs. So I don't know if anybody has a two-story house. My stairs are frequently cluttered because, again, I have 3 kids, and I'm like, I am going to trip and hurt myself. We want to keep clutter off the stairs, okay? Cords all over the place here. So cords can be a challenge, especially if you live in an older home. Nowadays, when they build homes, they put a lot more electrical outlets in. If you are in an older home, you might just have that one electrical outlet, but you really like that lamp right here. And so we have a cord issue. So we want to be sure that we put the cords around. If you must stretch it out a little bit, it should go around the perimeter of the room so that you can kind of tape it down. Or we need to have the lamp closer to the outlet, okay? Or, this is pretty cool, they now have like these LED battery powered lamps and battery powered extra little lights. And so you don't even need a cord for some lights. So take a look for those, Amazon, Home Depot, Lowe's, wherever, okay? Battery-powered LED lamps or lights. They have some that are adhesive and that you can stick on a wall. So if you do have a dark hallway or you have some stairs, you can kind of put them there, even if you don't have an outlet for a nightlight, and you can light up that hallway. There are some that are triggered to come on with the dark, and there are some that are triggered to come on with motion, okay? A nightlight anywhere is a great idea, in your bedroom or to get to a bathroom, and we want to make sure that we have that path illuminated in case you're going to get up in the middle of the night. So, I did give you a nightlight. This one I think is triggered by the brightness in the room, not motion. Let's see. Yes, according to the ambient light. So it will, but it's not super, super bright. So it hopefully won't, if you put it in your bedroom, it hopefully won't create a problem with you sleeping. But that's a great example of where you want to put night lights in as many places as you can to make sure that you have plenty of light. Last thing I want to talk about real quick in this room are pets. So pets, right? What do cats like to do? Like weave in and out of your legs, right? Rub on you. Dogs might jump. Even a little dog. If a little dog jumps and you are somebody who has poor balance, that could be just enough to take you down, right? So we just want to be very, very careful. If it's possible to still train, and is that true? Like you can teach an old dog new tricks, or you can't? What's the phrase? I don't know. But try to teach your dog, right? If they're not trained, but about how not to jump, that would be great. If you're going to somebody else's home and they have a pet, don't be afraid to say something before you go. I know you have that sweet little dog, and I love your dog, but I am so unstable these days, and my balance is really poor, and if the dog jumps on me, I will fall. Would you mind putting your dog up while I'm there to visit you? You can say it in a really sweet way that doesn't make them feel, badly about their pet, okay? So don't be afraid to say that to keep you safe, okay? We've talked about furniture and rugs and boards. If you have some maintenance issues, we just want to make sure we do that. Some loose or uneven steps. Sometimes the carpet starts to peel up, right? So we need to have that tacked back down. Making sure we have some good lighting, and if you're not going to pay an electrician $1 zillion to come in and rerun lighting, those battery operated lights that are adhesive to the wall, okay? Okay, let's talk about bathrooms though for just a second. That's another very common place for falls. It makes sense. It's slippery in the bathroom sometimes. So we need a rug there, right? We need something in your shower or bath. There's lots of different kinds, and honestly, I've had this one for a really long time, and I think there's probably even better options than this. This is a pretty heavy one, which is good, so it's not going to peel up. It has the suction cups. The danger with this is if you never lift this mat up for 10 years, okay, it's not slipped one time until it does, right? Because of mildew building up at the bottom. So, and you are not going to want to peel up, and you can look at this, you'll just be like, I'm going to sell my house, I can't look at the bottom of that rug. So, take the mat up, you're going to rug. Take the mat up every few days, right? Ideally, every day you take a shower. Take it up and let it dry out, maybe over the side of your bathtub or wherever. But every week at least, it should be sprayed down with a mildew cleaner so that it doesn't get slippery. There are some other rugs that are like a loofah rug, okay, a loofah mat, and you can get that on Amazon, but it's that kind of loofah material, right? So you can scrub the bottom of your feet at the same time, and you don't slip, but it's supposed to be resistant to mildew and not really be dried out. Whatever you're going to have outside, we just want, outside the shower bath, we just want to be sure is completely non-skid and the backing is good. Even in my daughter's bathroom, it's peeling up and I need to get her a new one immediately because I stepped on it the other day, not even wet.
Do you recommend those, solid ones or granite?
I'm not familiar with those.
They're quick dry and it's yeah.
But a solid thing, huh?
Yeah, it's a solid,
Oh, I see what you're
like
saying.
a stone, sorry.
Yeah. I gotta tell you, I just don't know. I don't know. There's only 5 reviews. I can't say yet if it's free. But there's 5-star reviews.
They're everywhere now, so
Are
I'm
they?
just wondering.
I'll look into that though, because you're the first person who's asked me about it. I haven't been familiar with that. As long as it wouldn't look like it would curl up, right?
Yeah.
Yeah.
Well, I had never heard of this before, but the Visiting Angels with my husband started taking the mat and putting it on the wall.
On the wall to dry, or for what?
I don't know, I've never seen it before.
I don't know either.
Yeah, they would just put it on the tile wall.
And it would stick?
Yeah. That's wild.
I don't know.
I don't need.
That may be like an old chance to dry out. And so they were probably trying to keep it off of the wet floor and move it, but even the wall would have dampness, you know, on it. I don't know. I don't know why they did that. Okay. We just want to make sure our cabinets are organized well so that you're not reaching to the tippy top or having to get on a step ladder. A chair is not a step ladder. Okay? If you must get on a step ladder, then we really want you to use one that is similar to the photo with only one step, maybe two, but it has a bar for you to hold on to. Okay? But ideally, we're not getting on them.
Going back to the bathroom, the grab bars. It's possible to purchase grab bars at Lowe's or Home
It is.
Depot that are attached by suction.
It is. So I'm
Let
glad
me
you
tell
said
you.
grab bars because I got sidetracked with the mats and I skipped right over it before I went to the next slide.
Those suction will work until they fail.
That's exactly right.
And they fail when you grab them.
That's exactly right.
So,
So grab bars we want to be really careful with. They have the suction cup kind. That works for just a little extra hold on to this while I step out. But if you pull on it, that is not going to hold your weight.
I'll
So we really recommend
three screws or 4 screws into the stud.
into the stud, right. Into the stud.
Carpenter.
Yep, into the stud. We don't want it just in the sheetrock because it will pull out, right? Your towel bar is also not a grab bar. That's just in the sheetrock usually. So it will not hold your weight. So this is the kind we want to do. This can be a little bit of challenge in some people's bathrooms, mine included. I literally have no wall around my shower if I ever wanted to put a grab bar. And so that may be something. You can have it drilled into tile, okay, if you're willing to drill into your tile. But that would be something that you can call a handyman or some of these organizations to help with, okay? Thank you for bringing that grab bars. Okay, so step stools, we just really don't want to do that, okay? Last thing I kind of want to talk about is some exercise. Let me pull this chair over here. Oh, I love this pillow. Yeah, pretty. It was gorgeous. Okay, so the last page of your packet with the blue rectangles is an exercise packet. So when I say we want to exercise, don't run for the door, okay? That kind of scares everybody off a little bit. We're not trying to make you a marathon runner. We're not expecting you to be a weightlifter. But what we do want to do is encourage you to stay active every day. So this is important for those you care for, and it's really important for you as a caregiver because you need to stay strong and healthy to be able to care for your loved one. So stay active every day. Be a part of some of the senior centers, the YMCA. I don't know if they offer any kind of exercise things here. Wherever you can find them to do some exercises. Sometimes you might need to do it from a chair, or those who you care for who have some mobility issues might need to do some things from a chair. That's okay. But what we're looking to do is to build up some muscle in our legs to give us some better strength and to improve our balance. So I don't have upper body exercises here. Those are important too, but really we're for fall prevention, we're focusing on our lower ones. So ideally you would do something every day for at least 15 minutes. You don't have to do all these exercises, but lead those that you care for with whatever they are capable of. Lead them to do some of these exercises to try to help keep them a little mobile, okay? So the sit to stand is the first one. There's little pictures to help remind you what these are. But the sit to stand is the first one. And so a dining room chair is great. We don't want to do a rocking chair or, you know, even like a big cushy lazy boy. No, we want, see if you have that. I see it behind your blue folder. and then flip that over.
I looked
A
at
dining room chair is great. You may or may not have arms. If you don't have arms, they can put their hands on the table, okay? So, or on the top of your legs. So we want to stand, we want to stand and then sit. So we want to have our legs a little bit wider, okay? A wide base gives us a little bit more balance. And then our legs out, and we want to be more towards the front part of the chair. It's very hard to stand up from the back, right? And you might need to bring your legs back a bit and then lean forward. We say nose over toes, okay? So we can stand and then we can sit. And when you sit, you gotta be real sure that chair is where you left it, okay? And that it didn't slide. And also, we don't want you to like plop down. We want to try to control the sit a little bit. That challenges your muscles some. So ideally, we would do 8, okay? And eventually, if this gets easy, we want to work up to 3 sets of 8. That doesn't have to be all together. Maybe we do this in the morning and we do this in the evening. Maybe you choose to do some exercises at commercial time, like the commercials, right? However you want to do it. Okay. Chair knee raise. You can stand like is in the photo, but you can also sit. Okay? And we can raise our legs like this, and we're working our quads. Okay? And a little bit like in our hips. The side leg raises. You definitely want to hold on to something, but we want to, and you don't get extra points for going high. Okay? So little low movement, and you can go slow. The goal is not fast either, okay? But go slow. We want to do some on each side. And then the next one is heel to toe walking. This is best done along the back of the couch or your kitchen counter, but it's almost a little bit like you're on a tightrope. You don't fully have to put your feet one in front of another like a tightrope. That will challenge your balance, and if you can do that, super. But if you need to have them offset a little bit, you can. But we're really trying to challenge our balance. I want to be a little wobbly, because then I know I'm fighting against it. I'm contracting all my muscles to get my balance. But I have my hand right here to grab something if I need help. And I'm overemphasizing the heel to toe. That'll help me pick up my toes.
Can I just mention, I was late because I never try to miss my stability class. at the
Yay!
rec
I'm glad
center.
you were late for stability class.
It's so good, but I was just going to mention that the rec center is totally free. I always make sure I get an insurance every year that has silver
The
sneakers.
silver sneakers is great.
And it's
Perfect.
free.
Yes.
And it's wonderful.
And if you guys don't know about silver sneakers, talk to her later and she can let you in on that. Right? Tai Chi is wonderful. Tai Chi will help with your balance, okay? It doesn't have quite the building of muscle strength as some of these exercises will that will engage your muscles, but it is actually recommended by the CDC as a fall prevention activity. Tai Chi is fabulous. Okay, calf and toe raises. Again, hold on to something. You can kind of rock back and forth. You can do it as 2 separate exercises like it is here. Do your calves and do your toes. Or you can kind of do it as one. I'm rocking back on my toes and then up on my heels. And try to hold on to something. But we're strengthening our lower legs. You can also do the toe raises seated as in the photo. Okay? And then seated leg extension. This is another good one for your quads, is to kick out your leg. And listen, we don't want to be like just, kicking like this. Slow and controlled, and squeeze that quad and hold your leg up for 1 to 2 seconds before you put it down. So squeeze and lower. Squeeze and lower. Okay? And we want to do these exercises on both sides and work up. You're probably not going to be able to do 3 sets of 8 right away. That's totally fine. Okay? Do 1 set of 8 and then try to build up. Okay? You can do them a couple times a day. And you can lead your loved ones in that to help preserve some of their strength or build it.
Can you explain the standing crossover? one
Yeah,
more
so
time?
let's skip over that one. So the standing crossover is another balance one. So you want to be behind a chair or your counter or something, okay? And I'm going to cross my foot, one foot over another, and I'm ready to hold on, but I'm going to try to hover. And then I'm going to shift my weight a little bit to where I'm fighting my balance, like I'm trying to get balance, because again, that will kind of make you contract all your muscles and search for your balance, okay? And then I'll do the other side. And if you can't quite go all the way over and you can just get part way, that's fine too, okay? All right. Okay, so those are the exercises. I just want to mention canes and walkers that if you feel like you need one or it has been suggested to you to use one, don't be afraid to start using one. When I was trying to encourage my dad to use one, he said, and he was quite serious about it, yes, but as soon as I start using a cane, that makes me old. And that kind of broke my heart. But that is a real problem sometimes when our hearts and our minds aren't as old as our body is. I feel that very much for somebody who just turned 50, which I know sounds maybe quite young to you, but I don't know how I ever got here. Because in my mind, I'm not 50, okay? And I hope in your mind and your heart, you're younger than your body is too. Okay, so, but if we need a little extra help and a little extra support, that is better than falling. So much better than falling. We want to make sure we use a cane on the opposite side. If you have doesn't matter if you have two weak sides, but if you have an injured leg or a weaker side, we want that cane on the opposite side, and we want the handle to come up to about to our wrist, okay? You shouldn't be leaning over like this. Working with a physical therapist is a great way to help get you some personalized exercises for you and to help learn how to use an assistive device if you need one. Walking sticks will give you even more support. I have them over here if you want to try them out. And they're great for walking outside, especially, okay? And then your walker, if you or your loved one is ready to advance to a walker, that gives the most stability. So that can be really ideal. If you see on the cane that there's still some imbalance, it is absolutely time to move to a walker, because a cane will only provide so much support, okay? I will go back to this slide if there's anybody who wants to stay late, but we're running a few minutes behind, so I don't want to spend really much time on that. I just want to encourage you to set some goals for yourself. Set a lifestyle goal, something along the lines of that I'm going to exercise every day for 15 minutes, okay? And then something that has to do with your home safety and your maintenance, okay? 2 goals. Okay. Any questions? I did this class is sometimes a lot longer, and so I feel like I was a little rushed, so I apologize for that. If I'm here for as long as you need me to be here, if you want some questions.
I don't know. One of the worst and hardest things for me when my husband was in memory care is my goal every day was to go and walk him. I'd find him, they'd have them all sitting in the TV room, and I'd get him up and walk to his room.
Mm-hmm.
And one day, the manager, I don't know their titles, but the nurse, and they came up to me and had him sit down, and somebody come and get a wheelchair or whatever for him, and they took me in the other room and asked me to not walk him anymore. And that's
What?
it's
Well,
the hardest thing
I bet that was really hard for
no more
you.
goal.
I can see why. I bet that was really hard for you. And I don't know what your husband's mobility was like in that moment, but they were really afraid he was going to fall. And I don't know if there was something they saw that made him nervous, about him falling, but to have a person fall within your facility, whether it's memory care or a nursing home or a hospital, is a really big deal.
Well, I think the
And
only
it may
time he
have
ever
been
fell
nervous.
was when they'd have him in a dumb wheelchair and he'd try to get out of it.
He
whenever.
did, yeah.
You know, oh,
And that
it's
can
so
be
hard.
really hard,
Sorry
right?
to interrupt, there is a Ford Edge in the parking lot with its headlights on. It's like SHC 5189 on the left.
Uh-oh. Okay, hey, we're wrapping up, and so I don't want you to rush out there. And you had a near fall when you came in, so take your time, that's all right.
Okay,
You can
we
come
got-
back for your stuff, nobody's kicking you out.
You can wait a few minutes and then you can go, and I'm happy to also walk out with you, okay?
Can you share, or do you share your slides when you do these?
I
That
can.
would be great, some of the ones that we didn't
And
get to
she's actually
see.
recorded this, and so if there's anybody who wants to watch it again or share it with somebody, then you can do that as
Some
well.
of the slides were really quick though,
I
I'd like
did
to be
zoom
able to
through.
see them.
Yeah, yeah. This is, a lot of times this can be even a 3-hour class or a 2-hour class, so I rushed and I apologize if we rushed, but we didn't want to keep you also away from your family for too long. So that was part of that. Okay. Thank you for coming.
Thank you.
Yeah.